Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. What happens when the final step of a vital metabolic cycle simply stops? Today we are looking at a breakthrough in rare metabolic diseases, Arginase 1 deficiency, or ARG1D, and a newly approved enzyme replacement therapy, pegzilarginase. To understand how the new treatment works, we need to start with the biology. The urea cycle is the body's primary system for detoxifying excess nitrogen generated from protein breakdown. Under normal physiology, arginase 1 catalyzes the final step of this cycle, converting arginine into ornithine and urea. This reaction serves two essential tasks. First, it enables ammonia detoxification through urea formation. And second, it regulates systemic arginine concentrations. In ARG1D, an inherited genetic mutation in the ARG1 gene results in reduced or absent arginase 1 activity. When this final step fails, arginine is no longer efficiently metabolized. Instead, it accumulates in the blood and cerebrospinal fluid, a condition called hyperarginemia. Over time, elevated arginine drives progressive neurotoxicity. Clinically, patients develop progressive lower limb spasticity, loss of ambulation, intellectual developmental delay, and seizures, among others. Unlike other urea cycle disorders, hyperammonemia is often less severe. Instead, chronic arginine elevation is the dominant driver of neurological decline. Standard treatment has focused on dietary protein restriction, ammonia scavengers, and symptomatic neurologic care. Dietary restriction can reduce nitrogen load, but it rarely normalizes plasma arginine. Most patients remain chronically elevated, and motor decline continues. What has been missing is direct enzymatic correction. In February 2026, the U.S. Food and Drug Administration granted accelerated approval of pegzilarginase, marketed as Loargys, for the treatment of hyperarginemia in adult and pediatric patients 2 years and older, with Arginase 1 deficiency. So, how does it work? Pegzilarginase is a recombinant human enzyme replacement therapy that utilizes cobalt substitution to enhance catalytic activity and pegylation to extend its half-life. Pegzilarginase metabolizes circulating arginine directly into ornithine and urea in the plasma. This is classic enzyme replacement pharmacology, but applied systemically to correct a whole-body metabolic imbalance. The pharmacodynamic objective is straightforward: to reduce plasma arginine toward normal levels. The approval was supported by the Phase 3 PEACE trial, a multi-center, randomized, double-blind, placebo-controlled study. Patients with ARG1D were randomly assigned 2-to-1 to receive once-weekly pegzilarginase or placebo, alongside individualized standard care. At 24 weeks, pegzilarginase significantly reduced plasma arginine levels compared with placebo, lowering the mean from 354 to 86.4 micromole per liter. More strikingly, over 90% of treated patients achieved normalization of plasma arginine. None in the placebo group did. From a pharmacodynamic standpoint, this represents a profound substrate reduction. But laboratory normalization only matters if it translates into clinical benefit. So what happened functionally? Treatment was associated with clinically meaningful improvements in gross motor function measure and the 2-minute walk test. These gains were sustained through an additional 24 weeks of exposure. For a disease characterized by progressive spasticity and motor decline, stabilization, let alone improvement, is clinically significant. Improvement suggests the possibility of disease modification, not merely biochemical correction. The therapy was generally well tolerated, with adverse events mostly mild to moderate in severity and transient. From a pharmacology perspective, pegzilarginase represents targeted metabolic correction and a shift from supportive care to a disease-modifying strategy. From a clinical perspective, it offers sustained normalization of plasma arginine, functional motor improvement, and a new standard of care alongside dietary management. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.